My name is Dr.El-Zawahry. I'm a urologist specialized in bladder health and pelvic floor reconstruction. Frequently, patients come to our clinics with unclear information about UTI. So hopefully this video will provide simple understanding of UTI. So we have to understand that UTI is a broad term that explains infections of different organs. It may involve the kidneys, the ureters, the urinary bladder, or the urethra. So as you can see here, it is not a precise diagnosis. It's important to understand that fact because evaluation and treatment may vary depending on the organs affected. UTI is a very common diagnosis in women, and it is estimated that almost 70% of women will experience at least one episode of UTI in their lifetime. It is uncommon in men, and if a man has a UTI, this means that he will eventually need an extensive evaluation to identify the source of his urinary tract infection. So the question that comes to mind is, what will make someone at higher risk of UTI? There are many risk factors that can make someone more prone to UTI than others. Some of them we can change and others we can't, especially if they are built in our genetics. I can tell you about the most common ones. Women gender. Because women have an anatomically short urethra, which in turn will make it easy for bacteria to invade the urinary bladder and cause infections. Extreme of age, problems with immune system response, diabetes, and if there is any structural or functional problems of the urinary tract, such as bad drainage, stones, or scarring. Sexual activity is also a risk factor. Constipation is a big player, and it is unfortunately very common. All of these are potential risk factors for UTI. And we always think, how can we change these risk factors to prevent recurrent infections? How can someone tell if he or she have a UTI? Symptoms of UTI are different, and it depends on which part of the urinary tract is affected. If it is the urinary bladder, then we expect to have increased frequency of urination, burning with pee, bad odor of urine, pelvic or tummy pain. Sometimes you can feel that the bladder is not quite emptying all the way. Blood in urine and low-grade fever can present with severe bladder infections. Kidney infections, on the other hand, are more serious, and usually patients come with flank pain, fever, nausea, vomiting, and feeling sick. Kidney infection is very serious and requires immediate attention. I always tell my patients, if you have fever with flank pain, you need to come immediately to the ER, and any delay in treatment will lead to serious consequences. What do I do when someone comes with concerns of UTI? I usually start talking about the symptoms and try to figure out if it's really UTI or something else. Then I ask about the possible risk factors that can cause UTI before we proceed with the exam. In the exam, we examine the bladder, the urethra, the rectum, and the prostate in men before we proceed with tests that can help us with the diagnosis. The most common tests are urine tests. I often send urine for culture and sensitivity to figure out what kind of bacteria is responsible for the infection. However, this is not required in every patient, and not with every time you have an infection. We may need an ultrasound, CT scan, or MRI to see if your kidneys and urinary bladder have any problems. This depends on what we are looking for. If we suspect that the urinary bladder has problems, then we might need to proceed with some bladder tests. This may include looking inside the bladder to make sure that you don't have any problems in the bladder. As you can see, we don't need to do all tests to everyone. It usually depends on what kind of symptoms do you have. And remember, Not everybody is the same, and not all UTI are the same. The next question is, how do we treat UTIs? As we discussed earlier, UTIs are not the same. If you have urinary bladder infection, then we can start with increased fluid intake. Usually need about 70 to 80 ounces of fluid per day. I usually recommend to my patients to check their urine after going to the bathroom. If your urine is dark yellow, then you need to increase your fluid intake. Your goal is to make your urine light yellow to clear. Then what if you have bladder pain? Usually painkillers like Tylenol or ibuprofen are good to help with this pain. Also, some of the over-the-counter medications may help with bladder pain. These are the medications that will turn your urine into orange. When it is more annoying, you may need to start antibiotics. Like what we said earlier, you don't need to have urine culture every time you have an infection. If the infection is severe enough, especially when it is associated with fever, then we are concerned about kidney infection. In this case, you will need to have more intense and aggressive treatment. You may need to be admitted to the hospital with antibiotics into the bloodstream. Again, I can't stress enough that you need to come to the hospital immediately if you have fever and flank pain. Personally, I don't recommend delaying UTI treatment, especially if it is kidney infections. Why is that? What happens if you don't treat UTI promptly? If it is bladder infection, usually it will resolve without problems. But if it is severe bladder infection, then it may require longer treatment and may end up with the longer term infections of the bladder, or even may progress to bad kidney infections. On the other hand, kidney infections are different. They are more serious. They can progress to severe life-threatening infections or sepsis. Severe kidney infections often require longer treatment with antibiotics and may require ICU admissions. If kidney infections are not treated early, they may heal with bad scarring. Bad scarring destroys your kidney tissues, and they may end up with kidney failure, which may prompt dialysis. So as you can see, early treatment usually helps to avoid many problems, while delaying treatment, especially kidney infections, can lead to more serious and life-threatening infections and conditions. How can we fight recurrent UTIs? This is actually the most important message for you from this video. Number one, good fluid intake. As I mentioned earlier, taking 70 to 80 ounces of liquid a day is very crucial to help with avoiding UTIs. Number two, cranberry and probiotics. They are very good to boost your immune response. Number three, try to avoid holding urine for a long time. If you are not going to the bathroom every 3 to 4 hours, then there is a problem. It's either you're not drinking enough liquids, you're holding urine for a long time, or something else more serious in the urinary system. All of these will need to be addressed properly. Number four, constipation. Constipation is a major problem for UTI and urinary tract problems. So I always recommend to deal with constipation as early as possible to keep and maintain a healthy urinary system. Number five, avoid excessive intravaginal douching. This is very important, as too much douching will kill the good bacteria in your vagina, and this can cause infections. Number six, good hygiene. It's very important to keep good hygiene. However, I always tell everybody, don't overdo it. Overdoing this will lead to more problems. Number seven, if you have a urine leak, then try to use wet wipes to clean the skin. After you dry the skin, use some barrier cream to protect your skin and the surrounding area.